Welcome, and thank you for joining us today live or on the recording for episode 10 of Dr. Jeff Talks About Sex and Intimacy, the Power of the Pelvic Floor. It means the world to me that you have taken time out of your busy day to join us and learn more about this topic. I am so glad that you are here. So, we are on social media, all of your favorites, Facebook, YouTube, X, Twitter, you name it, we're out there. And we do need followers on Facebook. So if you go to Facebook and you're a Facebook person, please follow us, because when we have 100 followers, we will stream live there rather than just have the recording. And that will be wonderful for more people to learn. So please follow us on Facebook. The website. Oh, don't forget, you can listen to us on your favorite podcasts, on Spotify, on Amazon Music, on iHeart, in your car, listen to us. And on the website, don't forget, you can watch previous episodes. You can see what's coming up on our calendar. We have so many amazing, awesome guests joining us. So look there. You can get to Facebook. You can get to YouTube. You can get to all kinds of different things from our website. So please go to the website and you will find us there. Well, this evening, it's a little cold still in Chicago. I know it's warmer other places, but we're like right now we're about 42 degrees. So it's a little cold here. It's a little chilling, but we're settling in. And I'm so glad you're here with us this evening. Stress and tension. Wow. Stress and tension are everywhere. So that's for sure. Stress and tension are everywhere in our world today. If you're alive, you're experiencing stress in some form, right? As Eckhart Tolle wisely says, stress is wanting something to be the way it isn't. He also says it's a form of suffering and its effects go beyond just our minds. Stress impacts the body and in profound ways, disrupting the heart, circulation, immune system, digestion, and even the liver. And it also affects the pelvic floor. But stress, it isn't just really, when we think about stress, it isn't about what's happening to us. It's about how we perceive and respond to what's happening to us. As philosopher and psychologist William James reminds us, the greatest weapon against stress is our ability to choose one thought over another. So the way we judge, the way we react to internalize stress determines how deeply it takes root within us. And when we do internalize stress, it doesn't disappear. It doesn't go away. It lodges itself in the body. The body tells the story. One place we commonly store this tension is in our pelvic floor. And holding excess tension there in your pelvic floor can lead to a cascade of different problems and issues. It is not a good place to hold your stress. Trust me on that. So, tonight, we're going to dive deep into the pelvic floor to learn more about this important group of muscles. I am so excited about our guest this evening. She is amazing, and I can't wait for her to share her expertise with you. Dr. Dee Hartmann earned her degree in physical therapy from Northwestern Medical School of Physical Therapy, followed by a Doctor of Physical Therapy degree from St. Ambrose University. She is a pioneer. Literally, she is a pioneer in the fields of pelvic floor physical therapy and also in women's sexual health. And she has co-authored an amazing book, The Pleasure Prescription, a surprising approach to healing sexual pain, which helps women find a path from pain to pleasure. And she's just a delightful person, and I am so glad to welcome her this evening. So welcome, Dee.
Thank you. Well, thank you, Jeff. It's so nice to be here. What a lovely intro. Thank you.
We're so excited to hear about the pelvic floor this evening. Can't wait. We've alluded to it. We've talked about it in other episodes. And so now it's all you. And I know you've got some great models. So start by teaching us and showing us some things.
Wonderful. And, thank you again for having me. It's such a delight to be here. You talk about anxiety, and the pelvic floor. Did you know that, fun facts, that if you get scared, if you're nervous, if you're angry, if you start to move, the first muscle group to kick in are your pelvic floor muscles.
Wow.
So if you have anxiety, good chance your pelvic floor is overactive and doing what it shouldn't be doing.
Mm.
So it's a really cool indicator that gives us a lot of information. I'm biased,
Awesome.
you know.
Awesome. So glad you're here tonight.
Thank you. Thank you.
All right. Show us your models.
Okay, so I'm going to start with this. I have a picture of it in my talk, but I just wanted to show it to you in person because this is kind of real life. This is the pelvis, joint in the front, spine coming down to the sacrum and the coccyx in the back. But these are the pelvic floor muscles. They're the superficial group of pelvic floors are here, deeper here. Again, I'm going to show you pictures, but I really wanted you to see this first. The clitoris, the glands of the clitoris is here. The urethra, where the urine comes out, is here. The vaginal opening is here. And this is the rectum down below. So that is the pelvic floor. And also, before I go on, I also want to show you my clitoral model because we're going to be talking about this lovely, wonderful little piece of anatomy. This is a clitoral model. It's 2 times the size, but you can see how the clitoral complex sits over the vaginal opening and the urethra. So there's that. Okay, if we could have the slides, that would be great. All right, so there we are. We've talked about all of this. There's my email. If you have any questions at all or want to contact me about anything, please, no subjects is off topic. There it is for you. Before I get started, I always like to say that this talk discusses anatomy and pain while referring to those born with vulvas, ovaries, and uteruses. I will use the term woman and female, and I don't do that to offend or to leave anybody out, but I really do it to keep true to the women that I treated in my practice. I closed my clinical practice in 2017, and what I talked to you about are my experiences from almost 30 years in the clinic. Tonight, I'm going to give you just a little bit of anatomy, tell you a little bit how it works. We're going to talk just a smidge about sex and pain. I'm going to end with how important it is to have pleasure, not only in your life, but by having pleasure in your life, you can maybe find pleasure in your sex. This is a picture of what I just showed you of the pelvis, but obviously with all the external anatomy on it. As you can see here, this is the labia minora. This is the clitoral glands up here. We refer to this as the mons. This is the urethral opening, the vaginal opening, and this is the rectum down below. There again is the pelvic model, so you can kind of get a sense of what I was just showing you in an anatomical model. You may get a sense of better what I'm talking about if you think of this and birthing a baby. If you've ever delivered a child vaginally, you can look at this and go, oh God, yes, I remember that. Okay, whatever. You can go on, you can get off that now. But what I'm showing you is there are 2 layers of muscle. These are those superficial pelvic floor muscles that go from the front to the back, are very small muscles, but they're very important in keeping the vaginal opening closed when they contract. They also support the gland, the crura of the clitoris on either side. And this is the deep pelvic floor muscles. This is on the left is looking from the bottom up, on the right from the top down. Much bigger group of muscles, but again, they go from the front to the back, and they literally form the base of our core support. They're a very, very important group of muscles. I wanted to show you this because not only here are the pelvic floor muscles, as you can see down below, but it's really important to have a sense of what's in the neighborhood. If you come into the vaginal canal, you see at the end of that, the cervix, which is at the beginning of the uterus. But if we go in front of that, 2 places, here's the clitoris here, the glans clitoris here. This is the opening of the urethra that comes up into the bladder, sitting right down and underneath, in most cases, not all cases, in most cases, the uterus. And then if we go further back, we have the anal opening, and here is the end of the bowel, the large colon, as it comes down into the anus. And it's important to remember all of this because, you know, we talk about, when we talk about sex and we talk about pain with sex, I always kind of have to scratch my head and say, why did all of this really important stuff get put in a place that has a lot of pounding and pushing, and I've never found an answer. We also have to remember that there's a lot of stuff on top of the pelvic floor. This is actually a picture of a model that I had in my office. This is the heart up here and the lungs on either side. The respiratory diaphragm sits here. And this is the massive liver. I mean, it's huge. It's underneath your rib cage, more on the right side than on the left. This is the beginning of the stomach as it comes down and comes into the 22 feet of small bowel. That then comes around, goes into the ascending colon, the large bowel, the transverse colon, the descending colon, and the rectum as that dives down into the anus. And where the heart is where the bladder and the uterus are. They aren't on my model because it's an asexual model. But you can imagine how all that may just have an impact on what's happening in those pelvic floor muscles. The one thing that we need to remember when we're talking about any kind of pain in the pelvis, whether it's with sex or not, is that there are a whole lot of things down there that can hurt. It doesn't matter what you call it. Pain with sex is either dyspareunia, vaginismus, GPPD, GSM, vulvodynia, or vestibulodynia. All of those are medical terms for it hurts to have sex. I can't put anything in my vagina. Endometriosis is a disease of the uterus that can cause a lot of pelvic pain. Vaginal dysfunction with infections or recurrent infections in particular. Your bladder dysfunction. You can have recurrent urinary tract infections. You can have painful bladder syndrome. There are all sorts of things that can go wrong in the bladder, as with the urethra. Bowel dysfunction, chronic diarrhea, chronic constipation, IBS, all of those things can cause pain problems with the pelvic floor. Then we come to the pure musculoskeletal dysfunctions, the pelvic floor muscle dysfunction. Low back, hip, and coccyx pain can impact the pelvic floor in a big, big, big way, as can general muscle pain like fibromyalgia. So we kind of just need to keep all of that in mind when we're talking about what's happening at the pelvic floor, because it all goes together. And remember, when any of these things happen, those pelvic floor muscles come in, they think they're the hero, and they're going to hold everything still. And it can really cause a lot of problems. What do those doggone pelvic floor muscles do? I list here 4 of the most important functions of the pelvic floor muscles. The first is to support the organs, the ones I showed you on the cross section, the bladder, the urethra, the uterus, and the rectum. It's not very pretty when they fall out. So that support of the pelvic floor is really very important. Pardon me. They help to control urination and defecation because they contribute to the sphincters that keep the openings closed until the time is right. And as I said before, they truly are the base of the core support. We'll talk a little bit more about that in just a minute. Here's the key. It's those doggone pelvic floor muscles that rhythmically contract and relax with orgasm. We'll get into that just in a second because that's a really very important function. So I say that, how the heck do I know that that's what the pelvic floor muscles know? There really isn't a whole lot of study done on it. The one study that looked at it happened in 1983, but I've been doing some research with this lovely tool called the Lioness. This is a gray one. That one in the picture is a purple one. But what's so cool about this is that this goes into the vagina, and there are 2 sensors on either side of the electrode. And this lovely spot, when you turn it on, vibrates the clitoris. Doesn't vibrate the whole thing, just the clitoris. So that, back to the slides, please. When we go in to the pelvic floor, think of that going into the vaginal canal and having that clitoral vibrator up on top, and what that can show us. From the studies we've been doing, this is a graph that really represents what's going on. When there's no muscle activity, the line is straight. So and they're all done with this, which is basically a consumer product. This isn't done in a lab. This isn't done in somebody's workshop. This is done with women who own the vibrators at home. They put it in, it jumps around a little bit. This is the pelvic floor at rest. The pelvic floor muscles are fairly calm. They have some tension because they are supportive. When we just contract and relax, the graph goes up. We relax, it's flat. If we contract and hold and then let go, the graft stays down. However, when you see all these ups and downs, that's what the pelvic floor begins to do as the clitoris is vibrated. We don't really know exactly why, other than it's a clitoral reflexive mechanism, but we don't know for sure if it's purely from a muscle and a vibratory force on the nerve, or something from the brain coming down with a sexual response. We really don't know that yet, but hopefully we'll find out. The longer that clitoral stimulation is on there, the more the arousal, this is representing arousal, the more the arousal builds and builds and builds until those pelvic floor muscles are so excited they contract really fast, and then they let go. And then the pelvic floor muscles relax again. So this is that same graph, but I've added on this pink bar, because this pink bar tells us that this is where the person using the lioness suggests that her orgasm started versus where it ends. So as studies go on, we're going to be able to figure out exactly what the pelvic floor muscle does during orgasm, and does it correlate with what we know from the literature that was done in 1983. There's so much we don't know, and so many cool things to find out. It's really cool. Now, I've showed you this because this is from the study that we're doing. This top graph we're not going to pay attention to. The second graph is the one I just showed you. The yellow marks where that pink bar was. But these four graphs are all of the same woman using the same tool, the same mechanics. And I show you this because everybody says, what is the perfect orgasm? This is somebody who's very knowledgeable about her pelvic floor, very knowledgeable about the tool itself. You can see her orgasms are very different indeed. It just depends. The only thing normal about orgasms is when they happen. And when they happen, you can't really compare one to the other. Now, when we're looking at pelvic floor muscle strength, that's the ability to actively contract and relax, we have a lot of research. And I'm not going to go into the research, but I just want you to know that we've looked at women who are having their first baby. We look at women after they've had a baby, that first baby. We've also looked at pelvic floor function in women who are postmenopausal. And all of these are just really trying to see how the strength and the mobility of the pelvic floor impacts sexual function throughout the life cycle. This is actually a systematic review which looked at the importance of pelvic floor training and its full impact, regardless of where women are in the life cycle, looking at female sexual dysfunction. And again, I won't go through all the details, but the conclusion was that pelvic floor muscle training improved female sexual function. And that's kind of what we need to know. Working those muscles, I suppose, just like your biceps, your triceps, your quads, and your glutes, make you better and make you healthier. And with this, they make your orgasms that much better. So if we're talking about that clitoral vibrator, what does that do? This is a different study. And again, I'm not going to give you all the pieces of it, but this is a study that just gave little bitty, the teeny tiny, I can't remember the name of them, vibrators right now. These were women primarily postmenopausal women, and they just asked them to use the vibrator over the front of the pelvis for 3 to 5 minutes, 2 or 3 times a week for 3 months at a time. No interest in sex, no interest in orgasm, no interest in anything other than vibrating over the nerve that serves the clitoris. And what they found was that using that vibrator, even that much, all externally, no focus on anything, was associated with improved sexual, genital urinary, which is the genitals and the urinary system, and mental health were all improved. So that's just a little tidbit that if you have a vibrator, it's in your drawer, you haven't used it for a long time. If you just put it just on the bottom of your pelvis, you don't need to go back to this big, just right down here on the bottom here, right in the middle, and you keep your vibrator there and do it on a regular basis, it could make things better. However, what happens when our bodies don't work like they should? Why do we get pain right at the opening of the vagina? And that area, by the way, is called the vulva. It's not the vagina on the outside, it's the vulva. I'm going to suggest to look at what comes first, the chicken or the egg. Is it all the other things that we do without thinking? Is it how we sit, how we walk, how we stand? Is it tension in other muscles in and around the hips and in around the abdomen, the deep abdomen that are the problem? We talked about these organs. Is there a problem with these organs that can cause problems with pain at the vulva? If you've got IBS, if you've got painful bladder syndrome, endometriosis, what impact does that have on causing that pain? I pointed out there are 3 ligaments here. You can't see them really well, and I really just wanted to show that they're ligamentous supports that also can be looked at. This is the issues with how we breathe. I talked a little bit about that. This is a respiratory diaphragm here, and this are the pelvic floor muscles down here. So this is the abdominal pelvic cavity. When the respiratory diaphragm comes down, when we take a breath in, the pelvic floor goes down. When we breathe out, the pelvic floor comes up. So this is a real important perspective. If you're an if you're an upper chest breather, if when you breathe your boobs come out or your shoulders go up, we're not really getting a good transference of pressure down through here. And we'd really like to see that as a more appropriate way to breathe. Could it probably just be the vulvar pain itself? These are just 3 pictures of me. I used a finger because I'm a physical therapist, obviously, as opposed to a Q-tip, which physicians do when they're checking to see what kind of pain you have right there at the opening of the vulva. I used my finger at 3 o'clock on the opening, 6 o'clock, and 9 o'clock, very gently to see how bad the pain was, if there was pain there. Or could it just be everything else in the pelvis? And we're not going to go through this, but I wanted to leave this in here. This is just a very scientific anatomical view of what's going on. But I really just wanted you to get a sense of this. This is that ligamentous support that I made reference to a minute ago, too. It's really huge. This is what supports the uterus, what supports the bladder, what supports the rectum. All of this is important with the bony structure, the organs here. This is the bladder in the front, the uterus here, rectum would be here, and the muscles all help give us that pelvic support. What if there's pain when you just touch the pelvic organs? If somebody's doing an internal assessment and they're not going straight up to the uterus with a speculum to look to see what's happening at the cervix, if they turn their finger over and they touch the urethra and it causes pain or urgency. And the same thing in the yellow, if you take your finger up to the bladder and you touch the bladder and it hurts or makes you feel like you need to go to the bathroom, that's not normal. If you go up to the uterus and you try to mobilize it with 2 fingers, that's the red, and it doesn't go and it causes discomfort, that's not normal. Either with the green where we turn around and palpate the rectum. All of those things should be calm. They shouldn't cause pain with touch, but oftentimes they do, and that too can impact what's going on at the vulva. Maybe it's a lot of things just happening all at once. These are very similar to what we saw before, but a little bit different. These are the things that I saw during my almost 30 years of practice treating women with chronic vulvar pain. The musculoskeletal dysfunctions from falls, from low back pain. TMJ, jaw clenching can cause vulvar problems. Bladder dysfunction, bowel dysfunction, recurring yeast, obstetrical injuries, any kind of laceration or episiotomy or any injury with the coccyx. Menstrual history is a big impact on it, as does endometriosis, which you see there. And the use of oral contraceptives can also play a role. But we can't leave out changes in our hormonal systems. If we look at women during the pregnancy year, if they're nursing, well, let's just go before that. When they're pregnant, their estrogen levels are sky high. Once they deliver, their estrogen levels drop. And in case you don't know, estrogen is really very important. And when you go through menopause, you'll have a really good idea just how important it is. But we're talking about that birth year. So we have to go through the birth recovery. That can cause vulvar pain. Nursing mothers produce little to no estrogen, which can lead to vaginal atrophy, dryness, and very sensitive to the touch. The tissues become very thin and they hurt to be messed with. It can also cause a decrease in sexual desire and arousal. Interestingly, and very commonly, you see in perimenopause, which can start as early as the age of 40, and it keeps bumping earlier and earlier, or with postmenopause, average onset of menopause is typically around 52 years, all hormonal production dramatically decreases. And again, you see the same thing that we see after we have babies: vaginal atrophy, sensitive tissue, dryness, and decreased sexual desire and arousal. So we really get hit with these problems, and this isn't counting those on oral contraceptives, which can have some of these same problems. But we deal with this throughout the life of throughout our life cycle, regardless of how old we are. So the answer to that chicken or the egg question is, I have no idea. And who knows? Everybody is different. That's why we really have to take a look and see what's what. I'm going to do a video. I think we have enough time. This is a video that I did before I closed my clinical practice in 2017. It's 6 minutes long. It was created as a video abstract for physicians at a meeting in South America.
All right.
Oh no, this is
Wonderful.
not the video.
So
Okay, never mind.
I would like to
Take that video down. I sent the wrong video. If you look, my apologies. If you look in the chat box, you'll see it there, and you can go on YouTube. Basically, it shows you 5 exercises that you can do to help lessen that chronic vulvar pain. It helps with your breathing to decrease the sensitivity in your central nervous system. It helps to stretch and release some of the ligamentous tension that goes down into your pelvis. It helps to stretch some of those associated muscles, and it helps to renew some of that contract relax ability in the pelvic floor. If you'll take a look at that and go to that, and you have any questions, you have my email at the beginning. I have an exercise instruction sheet that you can also use. Send me an email. I'd be happy to send it to you. And my apologies, I sent the wrong email. So with that, with all of those things, whatever the case may be, you have pain with sex, where on earth do you begin? I would suggest beginning with the video and the exercises, doing them twice a day, working your way up to 5 minutes of pelvic floor exercises twice a day. But from there, and to bring pleasure back in your life, how do you do that? I mean, you've had this pain, you know your pelvic floor muscles are there now from all we've talked about. In the book, my co-author and I talk about 24/7 foreplay, or the 5 love languages meet the 5 senses. I'm not going to go all the way through it because we don't have time for that, but if you're interested, it's described in the book. But I just wanted to leave you with these thoughts about you and your partner. Know and respect your partner's love language. And if you don't know what that is, Google love language and you can get a quiz to show you. The 5 love languages are acts of service, words of affirmation, receiving gifts, quality time, and physical touch. If your love language is receiving gifts and your partner's love language is act of service, and you try to use those things to make your partner happy, you're never talking the same language, and that's a problem. So use that love language when you figure out what it is, and make your partner happy every single day, maybe even just a little bit every day. Hold your partner's hand whenever you get a chance, because you never know when you're not going to be able to hold it again. Make a commitment to date night every week. My husband and I did this. We had 5 kids in just under 6 years, and it was an absolute godsend. Stick to it. Schedule your babysitters. Try to go out during the week rather than on a weekend. Sit across from each other. Look in each other's eyes. You don't have to spend a lot of money. Just look at each other and talk to each other, rather about work and how many diapers you changed. Talk with each other about what's important in life. Tell your partner that you love them multiple times a day. You can't tell them too often. This was one from my mother-in-law. Never go to bed angry. That anger isn't good for your relaxation. It's not good for your heart. It's not good for your brain or your anxiety. Talk about it before you go to bed. And then, if you are angry and you settle that all out, kiss your partner goodnight every single night. Again, because you don't know when you're going to get a kiss again. When we do that, and we actually like the person we're spending our time with, and we want to jump in bed to have this wild, crazy, juicy sex, then that's where that all of that sensuality becomes a bridge to sexuality. If you don't have those things, if you don't really like your partner, if they don't do things you want them to do, and you want to jump in bed, they want to jump in bed, you want to jump in bed, whatever the case, it's pretty hard to have really wonderful, pleasurable sex. I'm going to go over this really quickly. I showed you my model. This is a diagram of the clitoris. So many people think that the glans clitoris is the whole 9 yards, that is the clitoris. And I'm here to tell you that's only a very small part. Although there are over 10,000 nerve endings on this teeny tiny little place. So if you have problems with just staying here and getting to the point where that stimulation hurts and you quit, you need to go someplace else. That glans goes up to the body and the knee of the clitoris, and then it comes down on either side. And you'll see it in just a second where it is on the pelvis. And so these are the crura or the legs. This black outline is the labia minora, the inner lip, the small lip that comes up and forms the clitoral hood and down. The urethra is here and the vagina is here. And these glorious bulbous things are the vestibular bulbs. And I'm here to tell you that with arousal, every single piece of this clitoris is pleasurable to the touch. So if you have an angry clitoris or you're overstimulating your clitoris, try to go down here. Try to go into the body. Try to go into these vestibular bulbs. They're right inside your vaginal canal. With arousal, these vestibular bulbs just get bigger and bigger and put a little bit of pressure on your vaginal canal so you can put your finger inside and outside. They too can help increase your arousal. This is just the model again to show you what that looks like. But what you see here are the clitoral nerves. And the clitoral nerve is almost as big as the clitoral nerve that goes down to these last two fingers. Okay, so it's a really amazing nerve. This is where that clitoris sits on the pelvis. This is that pubic symphysis in the front that I showed you. Vaginal opening, urethral opening, the glands of the clitoris here, the body, the neck, and the crura off to the side, with the blue being those vestibular bulbs. So again, all of that is arousable. All of it feels good. See what you can do with that. So to kind of close off, I want to give you some patient-focused exercises. Excuse me. Be really attentive to sensuality. Explore your five senses. And just as simple as going outside and saying, instead of looking at your phone or dealing with your kids or your purse, look up. And if it's a beautiful blue sky, say to yourself, God, what a beautiful blue sky. Or feel the breeze and think how lovely it feels on your skin. Have something wonderful to eat at lunch and pay attention to how good it is. Because every time any of those things happen, your oxytocin level, your feel-good chemical goes up and you just feel better. So give yourself permission to receive that pleasure. Never wears out, it never expires, and it never goes away. Pay attention to how you touch. You may like to be touched one way, your partner may like to be touched another way. Talk about it. Play around with it. Make it comforting. Make it pleasurable. Make it sensual. Don't start with the sex organs. I could have my husband play with my hair for days. You might like to have your feet massaged. Whatever it is, that's going to increase that oxytocin and make you more ready for those sexual and erotic touches that's coming after that. Explore your vulva so you know what it looks like. Get out a mirror. Lay down on your bed with your knees up when nobody's around and take a look at it. Spread the labia apart. See if you can see the glands of the clitoris. See if you can see your urethra. Identify your vaginal opening. All of those things are very important, and very few women ever do this. Work on your own self-pleasure practice. I think it's if you take nothing out of this, don't expect your partner to give you an orgasm. This is my new thing and why we wrote the book. And one of the biggest premises in the book is that you need to know what feels good. So using a very slow sensual touch, go all around the vulva, not just at the clitoris, including all parts of the clitoris, as I just showed you, but go around the labia, the lips, and all the way around and just touch it. It's not sexual, it's sensual. See how good that feels. And if you keep doing that, that might start to feel really good, and you might start to feel that you're getting aroused. And when that happens, then go more to the clitoris. Concentrate more on those parts to bring your arousal up even more. And don't be afraid to focus on outer course. Not all pleasurable sex comes from penis in the vagina orgasm. And I'm referencing heterosexual couples. Whatever the case may be, you don't have to have that for sex to be pleasurable. And we'll leave you with this, that sexual agency is one of the most important things, whatever you decide and whatever you take away from this talk. It really is a way to help you accomplish your goals. It gives you the chance to say exactly what results you want with sexual activities. It allows you to define yourself sexually and your sexuality. It helps you choose whether or not you even want to have sex or not, how you want to do it. And it gives you the ability, sexual agency gives you the ability to say, I really don't think I want to do that. So let's stop. Know what you want and don't want when it comes to sexuality, and decide and make those decisions stick in your sex life. And I want to just leave you with this, because I dealt with women with chronic vulvar pain, that worldwide, women suffer from chronic vulvar pain and sexual dysfunction, often in silence. Sex should never hurt, unless it's your kink and you want it that way. It should never hurt. How many women suffer? We really don't know. There are any number of ways that you can get there. And I talked about a lot of them, but I didn't talk about trauma and anxiety. But what we know is that all of that, and including the trauma and anxiety, does not mean that the pain is all in your head. Trauma, to be clear, can be throughout your body, all around, and needs to be addressed. Pleasure matters. Think about it every day. Like I said, it's free, it's easy, it doesn't expire. Take it in. Take the moment to take it in. Make filling your pleasure bucket something that you do every day. And remember, foreplay and pleasure aren't just for the bedroom. They aren't just for sex. They're for building relationships. If you have that foreplay and that fun play with your partner, you're going to like each other a whole lot better. And the one thing that I'll now finally say, I've said this several times, will truly leave you with, is we have a lot of knots to untangle before the flowers can bloom. Thanks so much for your time and attention. And this is the book that Jeff so thankfully spoke to you about. If you have any questions, please go back to the beginning. I answer the first email, healthyexpgmail at gmail regularly, and would be happy to answer any questions you might have. Thank you for your time.
Awesome. Thank you so much. Gosh, there was so much good stuff packed in there, Dee. Really great. Thank you. What a pleasure to have you on. And you hit on so many things. And our audience knows we talk about these things. We talk about outer course. We talk about pleasure and connection. And just reminding ourselves, sometimes people even get so stressful and uptight about sex that it's like it's supposed to be about pleasure and presence and connectedness. But if you're all uptight and freaking out about it, it's not going to be about presence, and it's certainly not going to be fun, right?
No, and we always say that they talk about the women's sex organ is their brain, which just absolutely makes me crazy. But women do have a tendency to stay more in their brain and think about what they need to do in the laundry and what they're going to have for breakfast the next day. Men are singly focused, and they're there, they do it, and they're able to keep those distractions away. That's why having this foreplay is so important, and being able to do it and bring yourself there. Full arousal can take as much as 40 minutes in women. Well, I know it's not in men, but in women, it can take a really long time, but you have to work at it and understand it.
I think, you and I both work with a lot of these patients. And so if you're out there and you're struggling, I have literally had patients say, it doesn't feel like a penis. It feels like a knife going in the vagina. That's how uncomfortable it can be. And there's a lot of reasons for that. It certainly can be a pelvic floor hypertonicity, but it can also be hormonal issues, lots of different things that need to be pulled apart and evaluated. But you are
Right.
not alone.
Right.
Those patients are not alone. It is a real struggle when it hurts to have sex, and it shouldn't hurt. But we both know it can happen. And so I know it can be really scary, but there is help. And people, I always say my pelvic floor physical therapists are like a gift from God to my patients so much.
Thank
They
you.
change people's lives. It's amazing what they can do with releasing that tension, reducing the tension, down regulating the pain and working on things. It takes time, it takes work, but the research shows too, it works. It is effective. So I think it's really, really important. A few questions that came in. First off, what are the common signs and symptoms of pelvic floor tension?
Well, if we're talking about sex, it's pain.
Mm-hmm.
But if it's talking about let's say, urinary urgency and frequency, typically we should empty our bladder 6 to 8 times a day. We should be able to go 2.5, 3.5 hours in between voiding. When we sit down to empty our bladder, the urine should start right away. We shouldn't have to push. If you have to push, that suggests to me the pelvic floor isn't doing what it's supposed to do and automatically letting go. You shouldn't have to push to urinate. If you have that urgency frequency, those muscles could be pushing really tight and squeezing the urethra, which can make you feel like you need to go when you really don't. So we can really work on renewing the function of those muscles, getting them to relax. And also I deal a lot with the organs. I want to make sure the bladder and the urethra are okay too. So I will treat those two to calm them down. Bowel dysfunction is a huge one. Back pain. I mean, I had somebody I attended, I was at an Ishwish meeting last week, and a physical therapist talked about a woman with sexual pain and penetrating pain. She couldn't have sex because it hurt too much. And she had hip pain and hip dysfunction. So he treated her hip dysfunction, and it was a male PT. He treated her hip dysfunction, and lo and behold, her pelvic floor said, "Oh, thank you very much. I'm going to relax and let go." A normal pelvic floor allows that to happen. If when you look at yourself and you have a mirror and you look at yourself and you can't see your you can't see your vaginal opening. If you kind of have to look way up and inside, chances are you have overactive or hypertonic pelvic floor muscles. Because when that happens, it pulls the tissue up and in. You should be able to see the opening. It should be there. You should be able to put your finger around it and let it relax. So hip pain, anxiety, trauma, endometriosis, premenstrual syndrome, a gazillion things can do that. And remember that pelvic floor is the first to react. So all of these things can play a part, and we just kind of have to pick it apart and see and figure out what helps and what doesn't help.
Excellent. Excellent. Another question, and this is a great question too from a participant. What role does posture play? And you talked a little bit about the hips and stuff in pelvic floor health.
Lots and lots and lots. If we spend our life like this, like many of us do these days with our phones or with our computers, we're like this all the time. We're putting abnormal tension. There's a tissue that wraps around all the organs, all the bones, all the ligaments, all the organs, all the nerves, the blood vessels, called fascia. The fascia goes from head to toe, all the way in your entire body. And if you're standing nice and straight, that tissue is not on stretch. But if you're constantly like this, you're putting abnormal tension all the way through that system. That in and of itself can have an impact on what's happening in your pelvic floor. Sitting crooked, if you have a history of coccyx pain, if you had a coccyx injury with delivery, if you have low back pain, if you have a funky walk because of a knee injury, All of that, it all goes together. Anything physical in our posture, in our habits, how we stand, how we walk, how we sit, how we hold babies. I mean, newborn babies, lots of mamas have pelvic floor muscle dysfunction because they're always, standing on one side with a kid on their hip. So it's just Jeff is so kind. Women's health physical therapists do this. They take a look at all of these things. They say, okay, let's get a full history. I don't want to know just why you're here now. I want to know what happened a long time ago. So many times I would have women tell me, oh my gosh, my mom made me go to the bathroom before we left. And every time I was out, I would go to the bathroom in every bathroom we came to. That's not normal. But that's really common in women who show up at my doorstep with inability to have sex because of pain at the opening.
So true. So true. Excellent. Excellent. One more question here. Are there any lifestyle changes such as diet or stress management that can support pelvic floor health?
That's such a great question. There was ages and ages ago, back in the 90s, it was thought that vulvodynia was caused by oxalates. You remember those days? I don't know if you were doomed, like the oxalate diet, low oxalate diet. I think that we found that really wasn't too much the case, but that whatever. Stress management is key. Again, it's like I said, if you have anxiety, if you have stress, pelvic floor muscles are going to go right along with that. You have to learn how to breathe. You have to learn how to focus and calm your body. Breathing and breathing is the best way. And the best way to do that is this is in the video as well, put your hands on the bottom part of your rib cage. And when you breathe, your hands should go out to the side. And when you let go and breathe out, your hands come in. Your shoulders shouldn't move. Your chest shouldn't move. Just your rib cage should move. By doing that pressure gets facilitated all the way through the organs in your abdomen, all the way down to your pelvis, and really kind of lets everything just relax. It also downregulates your central nervous system. It brings down your blood pressure, brings down your heart rate. Deep breathing, so easy, and it's one of the most important things you can do and the easiest things you can do. Nobody even knows you're doing it, but it's really, really, really important.
Wow, so much great information. And oh my gosh, like you gave the greatest segue in the world into like our centering exercise at the end. So I mean, I just can't thank you enough, Dee. I love you dearly. And you are just such an awesome presenter. So good. I really hope you'll come back because there's much, much more to unpack in women's sexual health. So I would love for you to join me again. You are just a wealth of information.
Oh, thank you.
But thinking about that, wow, you just heard Dr. Hartmann say that it all starts, like the first place the tension goes is the pelvic floor. Where in your body is the tension and stress going? Because it is showing up and it's taking lodging in your body. So let's center ourselves. Let's take a moment to pause, settle into a comfortable position. You hear me say every episode, and you just heard Dr. Hartmann say, breathing is incredibly powerful. So if you're able, gently close your eyes. Now take a deep breath, 3 to 4 counts in, and slowly exhale for 3 to 4 counts. Let your shoulders drop. Let your jaw soften and release any tension in your pelvic floor. Let go of anything you don't need in this moment. Scan your body. Where do you feel the tension? Breathe into that space. With every exhale, imagine releasing the tension and melting, letting it melt away. 4 counts in, slow breath. As Dr. Hartmann said, breathe deep from your abdomen and diaphragm. Breathe, let your rib cage expand. And then as you exhale, just feel the tension melt away. Feel it melt away. Now silently or aloud, repeat these affirmations. Why is it so true that I am at peace? It's already formed in you. Why is it so true that I am at peace? I release what no longer serves me and welcome ease. My body and mind are restoring balance with every breath I take. I release all tension and stress and relax into my true and peaceful self. That's who you are. Take another breath in. Exhale fully. Feel the inherent, intricate connection between yourself and the world around you. Grounded, present. You heard Dr. Hartmann talk about being present with the person you love, the love of your life, being present with the people you care about, tasting, using your senses to feel and sense the world around you completely, not multitasking. Focus in the moment. Bring yourself fully to the moment. When you're ready, gently open your eyes and carry those affirmations, those things you formed in your body and your soul with you as you move forward. We are so happy that you joined us to learn this evening about the pelvic floor. And you know that tension loves to go there, so let it go. Let it go, people. Thank you so much for joining us. Let's see. Vic, can you show us what's up next week?
In this inspiring episode, Dr. Jeff is joined by marriage and family therapist Dr. Christian Jordal to delve into the complexities of romantic relationships. Together, they address common challenges couples face and share evidence-based strategies to deepen love, enhance intimacy, and foster lasting connection. Whether you're navigating a rough patch or looking to strengthen an already strong bond, this episode offers valuable insights and practical tips for improving your relationship. Be sure to join us next week to learn more.
Thank you. Thank you. You are a miraculous and beautiful being. And I thank Dr. Hartmann and I thank each of you. What a pleasure it is to spend this time with you. And I hope you learned something new. And join us next week for Dr. Jeff Talks About Sex and Intimacy. Thank you.